questions, in particular to your answer, Mike. You mentioned that 115 economies have started the vaccination against COVID-19, and our LinkedIn viewer is asking, are we working fast enough to immunize the whole world population?
I think the plain answer to that is no, but I think we're going as fast as we humanly can to do just that. The COVAX initiative is one major multilateral initiative with CEPI, with Gavi, with UNICEF and other organizations to really ensure that we get fair vaccine distribution around the world. And it was just fantastic to see that rollout begin. That's the end of a very long road, very complex negotiations and processes and agreements. So the teams that have worked on that for the different organizations and the national teams who worked on the national plans deserve huge credit today for what they have collectively achieved. But that does not solve the problem entirely. There still are issues of vaccine supply downstream. And there are all kinds of other issues around bilateral deals and countries, engaged in too much nationalism around vaccine supply. I'm the first one to agree that all governments have a duty to protect their own most vulnerable frontline and other workers. That's the sovereign duty of government, and they need to continue to expand their vaccination campaigns within country. That's an important right that any government has. But we also need to look at how we come out of this together and how governments can begin to share more doses of vaccine as they reach that moment where they've covered the most vulnerable. Can we see a way, as we've seen commitments from the governments of France and others, to begin sharing more doses of vaccine so that we can catch up the other countries who are further behind more quickly? So we're going fast. But we also need to obviously be careful that countries have the capacity to deliver those vaccines safely, and they have the trained health workers, and that they have the cold chains in place. This isn't just about bringing vaccines to country and dumping them at the nearest international airport. There's a very important process of generating vaccine demand, making sure the cold chains are good, the workers are trained, as I said, and the whole system works. And we've seen, even in the most developed countries, it took time to get vaccination programs moving forward in an efficient manner. It doesn't happen by itself. It requires a huge amount of technical cooperation and support in some countries from organizations like UNICEF, like WHO, in humanitarian settings from organizations like MSF and others. And there are countries that are in extreme states of fragility, where governments are not stable, where governments don't necessarily have access to the full population. And many international partners, both UN and non-governmental, are working in those countries to help support governments to move these vaccines quickly to the populations that need them, and including national non-governmental organizations. This needs a whole of society approach. So, it's always frustrating. You never move as fast as you want to move, and we would like to move faster, and we will use every ounce of our energy to continue to accelerate vaccine distribution. But as I said, vaccines are only part of the answer. They're a major, major, major development, and we should be celebrating the arrival of these vaccines. But they're part of the solution. As I said, our own individual behavior, our ability to reignite public health surveillance linked to vaccines gives us a way out of those really restrictive measures that we've all been under for months and months and months. So there is a path, but the pathway out will not be a single thing that we do. It will be the many things we have to do and keep up over the coming months.
Thank you, Mike. There were a few more follow-up questions, as you were saying, when we see that cases are going down, what are the next steps and how we can open up safely? So one of our viewers is asking, when do you think large sporting events will be safe? And I know you're a football fan and you would like to go for a match and enjoy as our viewers, but do you think that would be possible in any time soon?
I think we're already seeing that. There's a number of countries in the world that are hosting and having large sporting events. So take a look at them. What do they have in common? Those countries have very low rates of disease. They have very, very good surveillance, and they have high levels of compliance of individuals with the measures that are in place. If you add in vaccination to that, then there is the opportunity for major sporting events to occur. But remember, the countries that have done it successfully, even without vaccines, have had great surveillance. They've been on top of every single case that occurs. They've invested in their public health infrastructure, and they haven't had to rely so much on these lockdown measures. So, in a sense, sporting events are a victim of the overall lockdown approach. When you need to separate everyone from everyone else in society, why do you have to do that? Because you don't know where the virus is. And therefore you have to separate people so the virus can't jump from one person to the other. That's the scientific basis of many of these lockdowns. But if our individual behaviors are preventing that happening in the first place, and we're using vaccine, and we're identifying cases and isolating cases and identifying contacts and quarantining contacts, we're doing that by other means, by surveillance, by vaccination, and personal behavior. As I said, if we get those three things right, if we get individual behavior, if we get public health surveillance, and if we get vaccination campaigns right, then the need to continue lockdowns becomes less and less. And as the need to do lockdowns and these much more comprehensive measures becomes less and less, then sporting events become possible. And again, we've seen lots of examples in countries that have that measure of control. If you control the virus, then society can open up. If you're not in control of the virus, then society can't open up. That's unfortunately the huge trade-off we face here. And there are great examples around the world of countries that have done just that.
Thank you, Mike. Thank you very much. Maria, maybe this is a question for you coming from Maimuna Tariq, watching us on Facebook. How many variants have been discovered until now?
That is a fantastic question. So it depends on what you define as a variant. And I'm not trying to be cheeky here, but I'm sure everyone is listening to the news and seeing that there are virus variants and mutations being detected and reported all over the world. I mean, I don't know how many right now have been reported in the media. WHO, though, has been working with partners to come up with definitions of what a variant is. A change in the virus. You know, this virus is naturally evolving. There are mutations that happen at a normal rate. And there are variants that are being reported because there's genomic sequencing. There's sequencing that's being done in a number of countries. And the more sequencing countries are doing, the more variants are being detected and reported. What we have a responsibility to do in working with partners is to help understand which ones are important and why. So there are a number of variants of interest, meaning that we don't know the potential public health impact they have yet. We don't know what potential impact they may have on any of our countermeasures, including the public health and social measures that we've mentioned, or any impact on diagnostics, therapeutics, or vaccines. We published working definitions, and I say working definitions because they will likely change over time as we learn more, on a variant of interest and a variant of concern. And we've issued these to our member states, to countries all over the world, so that they can have some boundaries of, like, you know, how do we define which one is important, and a reporting mechanism to us. And then with those definitions, we've recommended what countries need to do to understand them in terms of studies that are on the ground, like epidemiologic studies, looking at trends and incidence, case numbers over time, looking at severity, and then also a number of actions WHO needs to take with our partners to better study these. So we are tracking many variants of interest around the world. We are reporting on, in our situation reports, our SITREPs every week, 3 variants of concern that we're tracking globally. One was identified in the United Kingdom. This is the B117. We have one that was identified in South Africa. This is the B1351. And we have one that we are tracking identified in Brazil and Japan. And this is currently circulating in Brazil. This is called the P1. And what we are tracking are a few things. We're tracking where the virus is circulating, in terms of which countries this virus is circulating in. We are tracking the research that is ongoing by the countries to evaluate transmissibility. Is it more transmissible or not, and why? any potential changes in disease presentation and severity. And also we are coordinating research on understanding the virus's impact on neutralization, on the body's ability to develop antibodies. And then we are linking, coordinating research with many, many partners and manufacturers on the potential impact of available diagnostics, therapeutics, and vaccines. So the three variants of concern that we are tracking, the one that was identified in the UK, first identified in the UK, first identified in South Africa, and first identified in Brazil. These viruses have a series of mutations, and some of them are quite similar. They've arisen at the same time, but they're different virus variants. And some of the research is saying that they have increased transmissibility, which means they can actually the mutation that has been identified in these variants, it allows the virus to bind to human cells more easily, and it can infect cells more easily. And so there's increased transmissibility. Having said that, we do know that the public health and social measures that are in place, the hand hygiene, the physical distancing, the wearing of masks, work against these virus variants. There is some indication that the B117 variant has some evidence of increased severity, and that has come from some preliminary studies from the United Kingdom. And so, of course, that is worrisome, because if you have more increased transmissibility, you'll have more hospitalizations, and if you have more hospitalizations, you can potentially have more deaths because the system is overwhelmed. But we do know with these three virus variants that the diagnostics still work, which means we can still detect cases that are infected with these variants. We know that therapeutics are working, although there are a lot of studies that are underway to look at if there's any potential impact, potentially on the monoclonal antibodies, for example. And we do know that the vaccines that are out there work against these virus variants. Now, there is some suggestion that some of the vaccines may have reduced efficacy, but they still do work. So we need to make it clear that everything that I'm saying is at the present time. And I want to couch this in that way because we are watching science unfold and we are watching research unfold in real time. And these studies are ongoing. So we are constantly learning about what these variants are and what these variants mean in terms of public health and medical countermeasures. So there's a lot that we're tracking. WHO has also established a global risk monitoring framework over the course of the past many months to look at these mutations and detect them quickly, report them, and then have a coordinated mechanism by which we study them and identify the triggers for decision making. What will trigger us to say, the IPC measures don't work? So right now we know that with these virus variants, our public health and social measures work, our infection prevention and control measures that are in place work against preventing the spread. And that's really important. Should that change, should we have a different virus variant that is identified and reported, we will make adjustments to our guidance. So we need to keep track of this in real time. And we're so grateful for all of our partners around the world in various lab networks and flu lab networks and HIV lab networks that are sequencing, our regional networks in PAHO and AFRO with Africa CDC. Many countries have really increased their sequencing capacity. And this is good because this gives us eyes and ears. But it is a lot of work to make sure that we not only look, but we also are triggered for action when necessary. So it's a long answer, Alex, but I think this is really critical because these virus variants pose some uncertainties for us going forward. And we want to just make sure that we have a system in place to activate any changes that are necessary and alert our member states and all of you should something change.
Thank you, Maria. Here's a follow-up question from Jaya Kumar, watching us on Facebook. Are we publishing data about these new variants somewhere on our website where our viewers can have a look?
We are publishing them in our weekly situation report, where each week we have a section on variants. We alternate each week. One week we have a shorter section which focuses on geographic spread of the variants of concern. And then the following week we have a longer section which updates on research, updates on the studies that are coming underway. And we actually have a very helpful table. I find it very, very helpful because it outlines everything that we know about the variants of concern, the names of the variants, the different mutations that are there, the results of studies on different vaccines. So you can actually look in there and say the Moderna or the Pfizer or the AstraZeneca, what do we know about this right now? Transmissibility, and then it gives other links to other full reports